Hi, welcome to Carosity Podcast. I am your host, Jeremy Watkins. I want to take the time to thank you for listening to this podcast. I hope you can use it as a resource to help you on your journey of caregiving. Today, I want to talk about something very important that needs to be focused on, especially in the in-home care setting, and that is infection control. And we practice infection control by practicing standard precautions. Standard precautions is a standard that we use for all patients and clients and family members and ourselves to protect against the spread of disease and sickness. And these standard precautions are simple, yet so very important. The first standard precaution that I want to go over is hand hygiene. Hand hygiene is probably the most important role that you can play in preventing the spread of sickness and disease to your loved one or your client, patient. And it's vital that you understand the correct way to wash your hands. And hand hygiene is not only about washing your hands, but it's also about keeping your fingernails clean and trimmed and on top of washing your hands. So washing your hands, you want to have hot water, as hot as you can stand it, is what I tell people. And you want to have good antibacterial soap, paper towels available. So you want to wet your hands first, and then you are going to put the soap in your hands, and then you're going to start scrubbing the palms of your hands together. And then you're going to want to get between your fingers, and then you're going to want to wash the backs of your hands, and then you're going to want to scrub the ends of your fingers on the palm of your hand. This will help get the soap up in your fingernails and clean the ends of your fingers. And then you also want to remember to get your wrists, wash your wrists as well. I like to go up as far as about halfway up my arm when I'm washing my hands, just to be sure. And then you want to rinse. Rinsing your hands, you just put your arms down and let the water rinse the soap off from top to bottom. And before you turn the water off, you want to grab a paper towel and dry your hands thoroughly. And use that paper towel to turn the water faucet off, because you don't want to touch your just cleaned hands on a dirty water faucet, because you just turned that water faucet on with your dirty hands before you wash them. And keep in mind also, if there's a door handle, you're going to want to use that paper towel to open that door handle, so you don't touch it with your just cleaned bare hands. And what that is called cross-contamination. So you just wash your hands and then you touch a dirty surface. That transfers the germs on that surface to your just cleaned hands. So washing your hands was almost pointless at that point in time, because you just cross-contaminated your hands right after you wash them. So you want to keep in mind that when you're washing your hands, you're doing it for a purpose, and you want to keep your hands cleaned prior to starting that task, whether it's care for your client, or preparing food or handling medications. You want to keep in mind the purpose for which you are washing your hands, and you want to keep your hands clean through that entire process. So create that barrier using a paper towel to turn off the water faucet and open any doors. If it's a push door, great. You can just use your knee or your back to open the door. But anyway, you get what I'm saying. So you want to keep in mind to keep your hands clean through the task that you're getting ready to do. And I did mention that, you are washing your hands for a reason. And I like to tell the caregivers that work through my company to wash their hands as soon as they get to a client's home. And of course, before doing any task like meal preparation, medication management assistance, or even personal care. You want to wash your hands before and after. And you're going to want to wash your hands before you leave the client's home. This helps prevent the spread of any sickness. It protects you and your client. The second standard precaution I want to talk about is environmental cleaning and disinfecting. This is very important in the home, as just as important as it is in a hospital or a facility. You are going to want to disinfect counter surfaces because that's where you're going to be preparing food. You're going to want to keep tables disinfected and doorknobs and toilets cleaned. The floor, you're going to want to make sure that trash is properly disposed of. Housekeeping is vital in the in-home care setting because that is another way that disease and infection and sickness spread is through poor housekeeping. So you're going to want to make sure you are using good disinfectant, that you are washing the dishes very well if you're doing them by hand, or if you have a dishwasher, use the dishwasher because the dishwashers will automatically sanitize those dishes. And if you're, washing dishes by hand, you want to make sure that you're using a good clean sponge or cloth. You don't want to keep reusing a dirty wash rag or a dirty sponge to clean dishes because that's just transferring bacteria back and forth from the sponge and the dish. And you want to make sure that if you leave dishes out to dry, you're going to want to make sure that you use a clean towel to set them on instead of a dirty towel. Like if there's a towel that you dry your hands on or wipe food on, you're not going to want to use that to put clean dishes on to dry. It's these basic things when it comes to keeping the house clean that are very important in the prevention of infectious disease spreading. Another thing I want to talk about, it kind of goes along with medication management, is injection safety. This is another form of transmission, more so with blood and bodily fluid contact. You're going to want to make sure that if your client or your family member takes injectable medications, that they are using clean and sanitary needles. If your client or loved one has to prick their fingers to check their blood sugar, you're going to want to make sure that they are using clean and sanitary needles for all of that. And you're also going to want to make sure that those needles are disposed of properly, where they can't be touched again. So making sure that those things are done will help stop the spread of infectious disease. Let's talk about respiratory hygiene. This was big during the COVID pandemic. Where a lot of people were wearing masks. And it's important that you understand the science behind why masks are important in respiratory hygiene. Because when you're around sick people and they're coughing and sneezing, And even if they're coughing and sneezing into a napkin or their hands, those things, those actions still release droplets into the air that then can land in people's mouths and in their nose, and that is how sickness is spread. And that is the premise. That was the premise behind wearing masks in public areas during the pandemic, was because that is how it was being spread like wildfire from people. Just, when you talk, you're still releasing droplets into the air. So talking and breathing, and just the simple act of breathing, still releases droplets into the air. And then you get a lot of people around each other. And even if one person is sick, that one person sneezes, and all of a sudden everyone else is going to get sick around them because of those droplets. So wearing medical grade masks, if you're not feeling well, if you have maybe a scratchy throat or a sore throat, or maybe the sniffles or a slight cold, you're going to want to wear a mask when working in the home with your client or your loved one to help prevent you getting them sick. The elderly are more susceptible to sickness and disease. Their immune system is not as strong as it once was. So it's very important that we practice these standard precautions to prevent infectious disease spreading, because it can severely affect their health and can cause major declines or worse. Let's talk about personal protective equipment, or short PPE. The most common ones are what I just talked about, was a medical grade mask, and others are exam gloves, wearing protective gloves. There are disposable aprons that you can wear. There are hair coverings, shoe coverings. All of these things are PPE because it protects us and others. That's why it's called personal protective equipment. Of course, there's goggles and anything that you put on or use to create a barrier between you and coming in contact with germs is personal protective equipment. And you want to make sure that you get to know how to use PPE correctly. When you're putting gloves on and when you're taking gloves off, you want to make sure you know the correct way to do that to practice infection control. When you're taking gloves off, after performing personal care or taking out the trash, or those gloves, the surface of those gloves are contaminated. So you're not going to want to finish a task and then start another task using the same gloves, because that is cross contamination. You're spreading germs from one place to another. And that's exactly what you're trying to prevent. So you got to keep that in mind when using personal protective equipment. Yes, you have it on, but that doesn't mean that it's necessarily protecting you or someone else if you're using it incorrectly. So you need to learn to use PPE the correct way. If you want to learn more about infection control and prevention, you can Google it, of course, or you can look up your local health department website and see all of the resources that they have concerning infection prevention and control. Well, that's all I have for this episode. I truly hope this helps you on your caregiving journey. Thank you so much for listening. Be well.